I often think of therapy as in two aspects. One is very goal-oriented and concrete, and then one is more feelings and patterns. So if I have a client that's very goal-oriented and wants direct results, I mean, even with clients that are more sensitive and empathic that way, there's always very specific goals and strategies you want to use. So I think that can be a difficulty in therapy where people talk about a therapist, they just listen and sit back and there isn't that kind of catalyst for change. So I really do value that, actually having obviously specifically what are the therapeutic goals and specifically how would we get there? Like what are the actual steps? What are the modalities we will be using? Session by session, reevaluating that. How is that actually going? And then adjusting from there. So I think both aspects of therapy, one to be very goal oriented and specific about what you're specifically trying to achieve. And then at the same time, a lot of times when you're dealing with emotions and historical wounds, sometimes it's pretty complex too. So you have to have some leeway to work with the complexity as it's evolving in therapy. I think that's one of the great things about therapy for men, actually, is it does give a professional forum for men to be working with their empathy, with their sensitivity, with their emotions. So I think therapy is actually really great for that because men often like a structured environment where they can see results. And I think therapy is a good place for that because it really does provide a very scientific, in a lot of ways, and structured environment where men can actually be able to find a place to actually work through the depth of their emotionality.